The purpose of this video is to discuss the reasons and rationales behind why my patients, myself, and my clients do functional range conditioning CARs, controlled articular rotations. So to understand the reason why we do CARs, the first thing we will need to discuss are joints themselves. So what I will do here is start to strip away all of the muscle from this guy or gal here and take off all of the joint's connective tissue. We will use the right hip as an example for this, number one, because it's easy to see, and number two, because it's clear that this is a ball and socket joint. So what is a joint? Simply put, it is the space between two bones that allows for relative motion. Now, we can see here that this is the upper pelvis bone here, and down here we've got the upper leg bone. And these are the two that will make up the hip joint primarily. The tissue that I will layer on next is of the utmost importance to the function of any joint. What this is called, which I've highlighted here in green, is the joint capsule or capsular tissue. And this being the deepest, densest connective tissue that holds these two bones together, this creates the environment of the joint within it, meaning that all of the synovial fluid, which is our lubrication to the inside of the joint, and all of the cartilage, which is the pieces that make that joint slide and glide against one another, is created, made, and housed within this tissue. We can see from the hip joint that it is a ball and socket. So this hip capsule should allow a rotational movement of the hip joint itself. This should be able to spin in socket around these axes. Now, if this is good, healthy joint capsule tissue, we can see that there are alignments of these lines. The fibers run in these nice organized directions so that when we rotate the hip, these fibers move in the direction of rotation. So if this is good, healthy tissue, the first thing we're going to find is that there's an adequate amount of rotation and range of motion. Second, when we get to the end range of motion, it is going to give us a nice springy barrier, meaning that as I get to the end range, it gives me this nice springiness. It's not a hard feeling of closing a door, and it's not a too soft feeling where I could just take the leg and rip it off. Obviously, I never want to do that. If this is unhealthy tissue, what we can start to understand is that the organization of that dense connective joint capsule is probably not well organized in these lines, that instead it may have undergone the process of fibrosis, by which these tissues and their alignment instead is going all these haphazard directions. What that will lead to is first problems with mobility, so that as you try to rotate your hip in space, because those tissues are not organized directionally, it will start to bind and tug and not allow a full range of mobility. Obviously, that is a problem. Second to that, what we might feel is that as we get to end range of motion where we can't rotate any further, then instead of that nice springiness that I talked about, it could be a very firm and hard end range of motion. So many of those changes you might visualize on imaging, you might see them in a cadaver dissection, but many of them can't be seen with the naked eye, meaning it is microscopic changes in these cells of the connective tissue that have gone awry. That's going to be a problem for anybody that is a Homo sapien human and needs to maintain their joint mobility. So back to CARs. The reason we do controlled articular rotations is to continually move the hip joint through its full range of motion, maintaining and keeping freedom and control over that access to mobility, which is essential. Now, if you are a normal human, you probably brush your teeth 2 times per day, I would hope. And why do we do that? We do that because we're trying to maintain the health of our teeth, and we have to do it daily for that to happen. So CARs should be performed on a daily basis to keep access of rotation into the joint. And all joints have joint capsules. Here I've highlighted the knee joint capsule here. We can go up to the shoulder and look at the joint capsule there. Every spinal joint has a joint capsule. Here we're up in the shoulder. Now, second to the tissue staying healthy, The second reason to do this comes down to the brain and the central nervous system. So embedded within the joint capsule is a specialized type of nerve fiber called joint mechanoreceptors. And what looks like just a single nerve fiber coming into here, this is actually branching in real life, branching out into hundreds, if not thousands, of small little joint endings that connect with this joint tissue. Now, the reason we have those is so that the body and the brain can sense where it is in space, so that as we start to rotate and move our joints, our brain is receiving that information. And it needs to receive that information from the joints because they are the deepest tissues that control movement. So as we move in space, this information gets sent from the joint mechanoreceptors directly into your spinal cord and right up to your brain and cortex. And what your brain is doing with that information is creating a picture or a map. It starts to understand the territory of movement. It's registering the angles and the positions and the direction that forces and gravity and exercises are starting to put upon the joint. Then it can tell the muscles what to do in response to those movements. So second to maintaining the health of the joint connective tissue and the joint capsule, what we are also trying to do is maintain this brain to body connection. By keeping the joint moving fully, we are also keeping your brain with a high level of awareness about that joint itself. So in short, you would want to do your joint CARs every single day to keep your joints healthy, to maintain their mobility, to add to a longevity of health in the joint, and to show your brain where you are in space so that it can make better decisions about how you need to move throughout your days. I hope you found this video helpful. If you have any questions, I can be reached on Instagram at Dr. Austin.